Sorry, if I open this up like this, can you see it? Can you see like a black box in the right lower corner?
I just see the presentation.
Okay, good. So I can keep this over here.
Yeah,
Oh no.
this is Refugee Center.
Okay, perfect.
Okay, so now, so good. Okay. So hi everyone, welcome to start our Refugee Center. So now we'll meet the team. So Victoria, she's our mentor and she's a master in applied science research at UNB. And my name is Mila Veljanovska. I'm a third biopsych student at UNB.
I'm Grace Wood. I'm a second-year biochemistry student at the Fredericton campus.
I'm Nicole Acupinpin. I'm in my first year of Bachelor of Science in UNB Fredericton campus.
And I'm Xiuming in the Renaissance College program in my third year at the Fredericton campus. So to start our presentation, we'll first discuss the scenario. We found three major areas contributing to the poor treatment that Amina received, which consist of the factors from the institutional level, refugee experiences, and the overlap of both. Regarding the institutional factors, the hospital staff seemed insensitive, impatient, and dismissive when communicating with Amina. Their attitude portrays a lack of cultural competency and stereotypical and prejudicial views towards refugees. Additionally, Amina has difficulty accessing affordable transit, which delays her visit to health services. From the perspective of unsponsored refugees like Amina, they tend to lack social and mental support. If she had close friends living near, she could have left her children with them to remove potential distractions during her consultation. As a new immigrant, she also lacks an understanding of the healthcare system. Therefore, the whole process of diagnosis, tests, and treatment may be completely foreign to her. Her low socioeconomic status causes barriers in receiving the necessary medication, as well as affordable and timely transportation to the hospital. The most evident issue in this scenario is created by both parties, which is the noticeable language barrier. The difficulty in communication between the patient and hospital staff makes diagnosing, testing, and treatment increasingly difficult. So with the presented issues, here are some of the short-term solutions our group came up with. The first is offering childcare services within the hospital to free Amina of distractions while she consults with us about her health issues. We would also recognize that she is a recent immigrant to Canada, so we would acknowledge the language barrier and be mindful of that. So to do so, we would need to remain patient, use gestures, draw out diagrams, and speak slowly to prevent any confusion from both parties. If it becomes more difficult, we would call someone from a local multicultural center to see if anyone can provide interpretive help. However, it is crucial to avoid asking friends or family, as it causes more harm than good. Additionally, because there were no available cultural interpreters at the hospital, hiring people for that position should now be considered a priority for the hospital. Because of the language barrier, it is valuable to run additional tests to ensure that her symptoms are communicated effectively to the hospital staff. From there, we would provide several treatment options and make sure that she understands the options and pursues the one she feels would work best for her. Since she and her family do not have strong social support systems in New Brunswick, we would refer them to a social worker to get them settled and in contact with the Multicultural Center. That way, they can start to build meaningful connections within the community. Overall, the importance of taking these steps is to ensure that we build a good rapport with the patient and her family. As they are from a new country, we must do everything we can to make sure they're comfortable in their new home and not discourage them from using healthcare services. By performing these steps, we strongly believe that there is a significantly less chance for Amina to return to the ER after this visit. Providing the proper medication will prevent the disease from progressively getting worse. Connecting her and her family to the social worker will help them settle down in Canada while developing support systems with those who understand her circumstances and offer guidance in the future.
So, as seen earlier, there are various problems faced by refugees. So, let us put numbers into that. So, 35% of the refugees do not know English or French. whereas 23.6% of refugees are smokers. 68% have high levels of self-reported mental health in comparison to the 72% of the average Canadian population. 9% of refugees are unemployed, and 14.4% saw improvement in their health after staying 4 years in Canada. So you might be thinking, what is the relationship of all of these? Well, the government of Canada has a thorough medical screening for immigrants and refugees that contribute to the healthy immigrant effect. HIE states that it's a framework that shows that immigrants and refugees are healthier than the average Canadian population. However, once settled, certain immigrant populations are at risk for health decline. So resettlement stress proposed by Baser proposed to be an effect of unemployment, lack of accessibility to services, and poverty. Refugees also tend to belong in the lower social-economic status due to economic barriers such as employment, cultural, and language differences. Thus, vulnerable population to mental health problems. Kutlu suggests that there is a relationship between the uptake of vices such as smoking that are seen among people with mental health disorders. It is found that people who belong in lower social economic status are more associated with tobacco use. With this, refugees are prone to uptake of poor health behaviors that lead to health deterioration. So what is our solution? Our solution is to spearhead an organization called Sprout, a center offering educational resources to refugees about Canadian society, as well as providing institutional systems information about proper ways to communicate and interact with refugees. Our center for the first 3 years will focus on educating refugees and the general public. Later on, we hope to offer programs and services to tackle other issues that refugees face. So our vision is to sprout new ideas to tackle the root problems within society and regarding the barriers and prejudice that individuals face. We will be partnering up with nonprofit organizations and educational institutions in New Brunswick. Our location would be Fredericton, Moncton, and St. John, since 89.5% of refugees reside in these areas. So we present to you our 3-year plan that is focused on the educational aspect for refugees and general public. So let us start first with the cultural competency. So the Royal College of Physicians and Surgeons of Canada and Indigenous Health Committee has a maintenance of certification program where they provide certification and resources for physicians in order to improve patient and physician relationships for Indigenous people. However, it is not mandatory. We believe that the same action must be done for immigrants and refugees, especially when Canada attracts a lot of immigrants and refugees each year. The program will include 3 aspects. First would be education. Banazak reported that medical humanities courses are becoming requisites in Canadian medical schools. For some, it is already embedded in the curriculum. This program will require full credit of humanities classes to reinstate the importance of empathy and inclusivity. Next would be exposure. Outreach programs with interpreters will improve the relationship as well as provide a more patient-oriented service. Last would be enrichment. So our research suggests that there is the obvious lack of medical training in rural or remote areas. With more outreach programs, this will allocate medical students and practitioners while addressing the problems of shortage in physicians in rural areas. This will also allow them to be exposed with people from diverse backgrounds. Next, we would have the healthcare package, which will be presented by Grace.
One of the main problems facing refugees is access to information and services. Providing a guide on Canadian culture, how the New Brunswick healthcare system works, what and where different services are provided, and health issues that are common to refugees will aid them as they move to the province. Having all of this information in one place will help alleviate stress on newcomers, as it can be very difficult to find all of this even when you know what you are looking for. The guide will be available in different languages so that as many people as possible can access this information, and will be given in physical copies at the refugee centres, as many refugees do not have internet access.
Okay, now so for career and education. In refugee center, career or workshops on how to build a CV and practice mock interviews will be made available. English and French classes, as well as after-school programs for children, will also be available at the center. The community may also be involved in volunteering or even enjoying the communities organized by the center. So for the buddy system, refugee children are 5 times likely to be out of school compared to their non-refugee peers. The buddy system will be implemented in grades 4 to 8, and it will pair students in a classroom that will participate in related activities. A research study by Slack and colleagues shows that grouping experiments or upper learning can lead to an increase in exam scores from minority students and improve racial attitudes overall. This program should be trial in Brunswick. Now we will also discuss the housing system. So in the housing system, is part of the future plan. And in the housing system, the family individual willing to support the refugee family will help by providing shelter, food, and company. This system or program has 4 steps. Step number 1, we will provide a questionnaire to the individual or family is ready for this kind of experience. Step number 2, criminal records for applicants with 3 reference letters. 3, interview with staff. And remember, this whole process is to ensure the safety of refugees. Step number 4, move in and check-ins and event plan for all participants.
These are some more services that the Centre could grow to include in the future. Services like encouraging refugees to sell food and crafts at the market, and a daycare that is partially staffed by refugees can provide them with income. A daycare would also enable refugees to go to work or to attend appointments and not have to worry about childcare. A volunteer clinic where physicians run sessions once or twice a week would also improve healthcare access for refugees. Our Refugee Education Centre will educate refugees on smoking and mental health to help prevent further health issues in the future. It will also help physicians acknowledge any implicit biases that they may have towards refugees and improve the communication between refugees and healthcare professionals. The goal of our Refugee Centre is to run all of these programs through one place. This will make programs easier to manage, plan, and navigate, and also make them more accessible to the refugees who need them. Here are some of the estimated costs for the Sprout Refugee Centres. The rent for each centre was based off of offices in each city. Utilities were estimated using NB Power's rates for businesses, local water and sewage rates, an estimate from IOTA Communications that an office building would use around 15 kilowatts of power per square foot each month, and an estimate from South Staff's Water that the average employee in an office building uses 50 litres of water a day. Thank you all so much for listening to our presentation. If there are any questions, we would love to answer them for you now.
I know that Mila's mic kind of cut out a bit, and if the judges have any questions about just the parts that she was talking about, feel free to ask about that too.
Yeah.
I have a quick question. Perhaps I missed it, but I noticed Sprout was capitalized. Is that an acronym for something?
Grace.
I mean, we were going to make it an acronym, and then we only got like 3 out of the 6 letters down, and then we like forgot to finish it. So like the first 3 letters are services providing refugees, and then we'll figure out the rest of that later.
Okay, fair enough. That's one of those brainstorming over some cocktails or something of that nature. So, but no, that's
Exactly.
yeah, that's good. I was just wanting to make sure. Okay, thank you.
Yeah, the most important aspect of any project like this is the acronym. And then whatever, once you've got a cool acronym, that's you're already halfway there, right?
Exactly. Who cares about getting funding or like how actually helping people is the acronym that people remember.
As long as you have a cool name, yeah.
Exactly.
Called one of our weight management study Game of Stones, right? Which works in the UK, right? And yeah, once I had a cool name, I actually needed to develop an intervention, and that was a minor task. And can you guys paint the picture of Sprout? What do you have in sort of? Is it going to be a physical space? What's it going to look like? Help me picture it a bit more.
Okay, so we were thinking about in each of the 3 cities mentioned, like having like an apartment, like an office space. So like around 2,000 square feet or something, where there would be a classroom so that we can hold classes, and like there'll be computers so refugees can get access to the internet, and just a safe space for people to come to when they need help.
Yeah, thank you. Can I ask a follow-on question? I mean, I know there were some make problems, but I still thought like the presentation was very clear, nice and succinct, and even though I couldn't hear every word, like the slides made up for it, so you could kind of get it from the context. Can I ask about the cultural competency program a little bit more? Sort of who's exactly the target population? What do you want them to do differently following on from the going to that program? And what's sort of the content of that?
Nicole, you're muted.
Okay, sorry. So our target for that one is going to be for physicians, since we noticed that the problem is that during the prompt, like the problem faced by the refugee is that they did not know how to deal with the refugees. So with the cultural competency program, we aim to reduce the barriers and educate them more about how to deal with these situations, because just like what I mentioned earlier, Canada has this program for indigenous people, and we believe that this program should also be implemented for immigrants and refugees, since the country attracts a lot of immigrants and refugees per year. So we want to emphasize on training and exposure, so that they will once they are practicing, they will be more aware and more competent on how to deal with people from diverse backgrounds. And it's not only limited to indigenous people.
We also plan, just to add on to that, we also plan on expanding it to the general public, so that the prejudice and the stereotypes of refugees can be like diminished a bit, so that they start understanding their situations and their stories, to build more empathy and compassion around that as well. But that's like within the further plans of the steps of getting the refugee center open.
Thank you.
Have you guys looked at an environmental scan regarding Sprout? Just when you think of these 3 municipalities, there are presumably a series of offerings. The Multicultural Association would be one that springs to mind, and how you would differentiate your offering, and also at the same time, perhaps, remove any type of like siloed effects in terms of being able to collaborate on some endeavors.
I think our refugee center is similar to other places like Magma, like multicultural centers. However, they cater to all immigrants that come to New Brunswick. And refugees have their own specific problems and unique problems that other immigrants don't. Like, for example, I moved here. I do not have the same like language barrier issues or health issues that many refugees that come to the province have. So Sprout would be able to target that more specifically. But I do also think it might be a good idea to work with the multicultural places for like language classes or something like that.
Also, just to add, we also mentioned earlier that we are planning to partner up with nonprofit organizations, since we believe that they are very vital and important in making this project successful, since they also have resources that will also help in starting up Sprout project.
Excellent, thank you. Yeah, it's always just something to be cognizant of from that siloed approach, because a lot of these organizations are, seeking the same financial support from the same pots. So sometimes things can get a little mucky in that regard, because they start to complain about the siloed aspect. I hear that here in St. John quite a bit, and that there needs to be an improved collaboration. So always something to be cognizant of. I mean, more organizations looking at this, of course, are great, but ensuring that they're all collaborating. And I think what you have here is a very multidisciplinary approach, which I think is excellent, and that opens up a lot more doors for how to collaborate with a lot of the local organizations that are already established. So thank you. That was a great presentation.
Okay, so Victoria, I'm not sure if you have any questions or if you're having computer troubles again, but.
No computer troubles this time. I'm good. I'm back. I thought the presentation was great. I think I was just listening to the other judges as well, and I agree with a lot of their aspects. It's like a broad spectrum, right? But I do like the approach to it, and I'd like, it would be nice to see something like that be able, to go forward in the future, having a center like that for refugees. I think you guys did a great presentation, put a lot of hard work into it, and I think in the long term it would be a very good plan.
Yeah, I agree with Victoria. May I ask one more question, if we have the time? So you guys mentioned that refugees come here and they're healthier than the average Canadian population, and then their health deteriorates over time. And you mentioned 2 targets where you would like to help, which is smoking and mental health. Do you think there might be other health promotion targets that you could go for?
Sorry, but can you repeat the last part of the question?
Do you think that there might be other health promotion targets that you could go for in addition to smoking and mental health?
So we also want to promote proper nutrition among refugees, since we noticed that upon our research, we found out that refugees and immigrants are the most food insecure among Canada. So we believe that if we provide a program wherein they will learn more about proper nutrition and how to the resources, to where to get the food, since it's also one of the problems, they don't really know where to get the food, the groceries. So we believe that if we also include a program wherein they will learn more about nutrition and health in general, just like what we mentioned with health literacy, it can also solve problems such as chronic diseases, since it's one of the most common problems among refugees.
Thanks.
Okay.
Yeah, also like prenatal care, that kind of thing would be important as well. Following the expectant mother, and also, well, I mean, that comes with nutrition, but also, all their vitamins and their health care, that would be another key area as well.
Yes, and also if you have the volunteer physicians coming in once or twice a week, then they can get checkups that way.
Exactly, that would be great. Agreed.
All right, so that's just about it for the presentation today. I just wanted to let the delegates know that your presentation was awesome, first of all, and that you'll have to be back for the networking time around 4:35 until 5:05. But until then, you can take a break, chill, do whatever. And to the judges and mentors, if you could go back and gather for the next presentation, that'd be awesome. Thanks.